Hello, everyone. So, in this today's session of obstetrical hacks, residency hacks, I am going to deal with a very important thing. It's not a clinical topic, but I'm telling you, this is something which you will be. This topic is going to help you maximum while you are in residency, even much more than the clinical topics, and that is how to handle difficult patients. This is something which you will not be reading any books. No books will guide you. Only people who have been through that process, like us and many other teacher of yours, are going to tell you. So this is going to be one of the most important classes for your residency, and everyone is going to face it. You being into a government college or into a private hospital, anywhere, difficult patients are there everywhere. Okay, hospital is a condition, hospital is a place that can make anybody, any calm person, a difficult patient. So it's not the person, it is basically the place where you are placed in, the place where you are posted, the hospital, that makes people act differently. So let's see how to handle difficult patients. Now, first and foremost, so when you are handling a difficult patient, the first and foremost advice I want to give to you, see, you can't change the world, you can't change the scenario, you can't teach others to be calm in a difficult situation, but you can teach yourself to stay calm, whether you agree or not. The starting tone of your discussion, the tone in which you start the discussion, decides the end of that discussion. So when your tone is already high, the end of that discussion has already been decided. So your tone should always be softer than the patient's tone. You have to understand that patient is somebody who is not willingly in that hospital. Obviously, the hospital duties are very difficult for you, the situations are very unhealthy for you, but you are there willingly. So you have to accept it. It is something which will come with practice. It will not come spontaneously. It's not a reflex thing. You have to learn that when a patient is in a panicky situation, that is the exact time when you should stay calm. So never raise your voice. You are not there to match the anger of the patient, right? You're not there to show who is the greater one at hospital. Everybody know who is the one, everybody know who is the knowledgeable one, who everybody knows who has the power, who will be deciding the fate of the patient. Everyone knows that. You do not have to prove it anyways. So just stay calm in a discussion. Keep your voice low, soft, but firm, right? So you should never be aggressive, but yes, assertive you should be, right? So this is the first thing. Always start in a low tone. Then, whenever you are talking to a patient, that patient might not act same when you meet them outside. So remember, why is it so that doctors fall into so many difficult situations? Why is it so that doctors are the one among all other professions that are facing so much chaos? It is not the person, it is the place where they are. So when a patient, a relative, a group is visiting hospital, they are in their worst condition, right? And I repeat, if somebody who is in that hospital completely unwillingly, that is the patient, right? So when you're talking to them, you might get furious by their tone of discussion. It is very easy to say then done. All have been through that. But once you practice, once you learn to see beyond that patient's normal behavior, once you realize that this patient is at its worst right now, that is why he is behaving so, your tone, your way of talking gets softened by itself. Remember, everything comes by practice. You have to learn to see beyond what is visible when the patient is talking to you. Okay? So somebody who needs to stay grounded in that discussion should be you. Okay? So stay calm, keep your voice low but firm. Okay? You don't have to acknowledge everything what patient is saying, but yes, acknowledge their condition that time. Okay? Second point. The third point. You know why the quarrel breaks up so frequently in hospitals? What is the reason of all chaos that happens in hospital? The basic reason is the uncertainty. When people know When people don't know what is happening inside the room, when they don't know what will be done next, that uncertainty brings out the panic. Keep yourself in similar situation. You are in a flight and you are being asked to wait, you will get panicked. But if you are told that you will have to wait for 10 minutes or 15 minutes, the reason being the flight's engine is not working properly, once you know the reason and you know the duration you will be waiting for, suddenly you are not panicked. But if you are just sitting in the flight, there is nobody to attend you, nobody to tell you why the flight is not moving ahead, nobody to tell you for how long you will have to wait, that will bring a panicky situation. And that too in a flight, it's not even a hospital. So imagine from a patient side. So always try to break that uncertainty, remove that uncertainty. You might have to work hard, you might have to communicate everything to the patient, but yes, if you want a peaceful environment, if you want to avoid chaos, that is something you have to do. Tell them the probable diagnosis that could be there. Tell them you are still not sure. Tell them what are the treatment options. Tell them what you will be doing in next 10 minutes or in next 24 hours. Maybe people will still panic. Maybe chaos will still break up. But at least you have done your job, right? So remember, whenever there is uncertainty, even if we, the well-read people, are put in uncertainty, we don't behave normally what we do. So always try to remove uncertainty, keep patient informed. So what you read in book, that keep informing the patient, the reason is to avoid that chaos and that panicky situation. So keep the patient in loop. Now here comes the major break. How to just keep the patient in loop. There are so many people around. How many times should I go and tell the diagnosis? When I go and tell the diagnosis, the people start shouting and howling. How to go about it? So here comes the main steps. When you are discussing with any patient, what I have learned in my years and what I have seen how colleagues used to handle the situation is the following points. First, never interact with a crowd. Never interact with a crowd. Always politely choose one key relative. So, because more is the number of people, more chaotic everything is. Choose one key relative who will speak, who will talk to you, and who will decide. Once one person is selected, the things will go smoother. And that one key relative will explain everything to the other relatives. Because, especially when you're in a government hospital, people never come alone. They bring almost half of the village with themselves when they are coming to hospital. So always choose one relative. Never ever take that point. Never ever talk to the crowd. Choose one relative, explain him everything, and he will be the key connect between you and all other relatives. He will decide what is gonna be done. So don't you be the person speaking to everyone. Let him be the person speaking to every other person. Also, when you are talking to the relative, never argue. Even if some contradictory point breaks up, never argue in front of crowd. A person behaves very differently when a person is separately sitting alone compared to when a person is with a group. When a person is in a cult or in a group, people reflect each other's feeling. Even if one person is panicky and aggressive, his feelings will be reflected by other and they will be keep on passed to others. So never argue whenever there is a point that you are not liking, that is controversial, or you're giving a bad news. Never do that in crowd. Never give a bad news in crowd, because even one aggressive person will result in an aggressive crowd. So always talk to the key relatives in private. People behave very differently when they're in a room separately compared to when they're in a cult. So always give bad news or argument in a separate private room. There are counseling rooms at many places. If there is not a counseling room, then there will be a separate resident room or a doctor room. Always talk there. So never a bad news should be delivered to a crowd. That means if that happens, that is a recipe for disaster. ठीक है. So always choose one key relative for every discussion so that you are at least not in chaos, you are having a smooth discussion. And breaking a bad news should always be in a room. Third point, document. I must say, what I have learned in so many years is document everything. Patient agrees for treatment, document. Patient refuse, document. Patient gets investigation, document. Doesn't get investigation, document. You are not there to make decision from the patient's side. Everybody visiting a hospital is an adult, so let patient have that right of choosing the treatment. If they don't want to choose the treatment, you as a person are not there to interfere. You are there just to document. So document every little thing, your plan, whether the patient agreed or not agreed, their consent, without sign, with sign, everything document if you want to stay safe. And especially when you see it's a difficult patient, it's a medical legal case, do not forget documentation. Even if it takes another hour of your duty, do document. So never force a patient to choose a particular treatment. They have their own rights. They have, just explain them what is needed, but you are not there to take decision on their part. It might harm, it might not harm, but that's not your job. Your job is to give information to that patient. Now what they want to choose is their right, but just write down everything on the paper. And the last point, you should know when to call for help. Don't try to be a hero. Sometimes besides doing everything, things can actually go very wrong. So you should know when you should call for help. Whenever you see things are going beyond verbal talks, whenever you see even one relative getting aggressive, whenever you see it's a significant medical legal case, especially something that can involve police, anything medical legal, always call for help. Call the security of that hospital, call the uh, management of that hospital, call your senior personnel, your senior consultants, but you should know the exact right time when you should call for help. When you say an argument is about to break, do not prove yourself to be a hero. Remember, they are in a group, you are not. So just call for help. So I know this is something which is not very academic, but I must tell you, this is something which is going to help you most during your residency years. Thank you so much.